Hi, I'm Jill Lally, and I'd like to welcome you to the DeFabio Difference for Better Health Management. With me in our studio is Dr. Donald DeFabio. He is a board-certified tridiplomate in chiropractic orthopedics, sports injury management, and chiropractic physical rehabilitation. Thank you for joining us, Doctor.
You're welcome, Jill. It's great to be here.
You know, in a previous episode, we were discussing strong posture for better health. And if you could just recap what is ideal posture and your concept of strong posture, weak posture versus good and bad.
Well, that's a lot of information we did cover last time, but a brief synopsis is, I'm going to go first with the strong versus bad and good versus weak. So traditionally, people say, oh, I just got bad posture. And in reality, poor or bad posture connotates something you have to live with. You're stuck with it. That's just the way you are. Whereas in reality, strong posture is achievable. And when you're tall and strong, whether you're sitting, standing, walking, running, playing sports, whatever, you are more mechanically efficient. There's less wear and tear on your joints, nerves. You're able to breathe better so you can get more oxygen into your system and carbon dioxide out of your system. Your attitude's better, your energy's better. Therefore, when you're tall, you're stronger physically, mentally, and emotionally and biochemically. Whereas when you're in a weak posture, you're all the other things. You just don't feel well, you can't breathe right, you're not getting air in, you're despondent, and you're having pain because now your ligaments, muscles, and discs have to work harder. But here, they actually have to work less. So that's why we talk about strong posture. It's achievable, it's doable, and it's applicable to everything you do in life. But first, you'll have to learn how to do it. So that was the first thing. And essentially, good posture is strong posture. Strong posture is from the front, eyes are level, shoulders are level, hips are level, knees are straight over the feet, they're not going in or going out, and feet are straight ahead, they're not rolled in or rolled out. All right? So really, strong posture starts in your feet, Jill, if you're standing. Right now, for us, strong posture starts in our hips, all right? But if you notice, I'm aware of what's going on here. Because if I sit like this, or let's just say I'm good and tall here, but this foot's doing this, guess what? This is just developing weak posture down the road. So for the viewers out there who have young children that like to kneel on the ground, have them kneel like Japanese style with their feet straight back. Don't have them kneel with the feet kicked out like that, okay? Because that's starting to develop weak posture as a child. And then as they get older, their feet turn out, their knees go in, all of a sudden they have knee problems, or they have hip problems, or they have ankle problems. And it all started because they were in weak posture as a child, all right? So that's the translation. From the side view, you want to make sure your ears over your shoulder, shoulders over the hip, hips over the knee, and that plumb line, that's a straight line, is slightly in front of your ankle. Not over your foot, just slightly in front of your ankle. And from your back, well, you want to make sure you don't have any spinal curves. All right? So the last show we talked about home assessment. It's a great thing you can do at home just to check yourself with 3 simple pictures. So they can do that as well.
How did you develop this insight and interest with posture, Doctor?
Talking to friends, talking to colleagues. And it made me realize that essentially that's what I do. Because when I give people exercises, with a big name for it is we deconstruct them, we break them down. We find out at what point somebody can no longer move efficiently with proper, strong mechanics, which is alignment, which is posture. Whether you're lying down or sitting or kneeling or standing, I'm teaching my patients how to move better. And that helps them return to function. So, in just brainstorming with other colleagues, and one of my colleagues used the term strong posture, and I went, wow, that makes so much sense. And then I thought how it applies to what we do in the office, from our ankle injuries to our shoulder injuries to our headache to our back pain patient. It's all about proper alignment. It's all about strong posture. We just weren't calling it that. And it's a concept, frankly, I think people understand. You know, if I were to tell you, Jill, we're going to improve your biomechanics to make you more efficient, you'd be like, oh, okay. But if I said, Jill, we're going to give you a stronger posture so you have less neck pain, I don't know, that seems more tangible.
Absolutely. And that you're talking to me as an individual for my posture.
Well, look, that's what the DeFabio difference is. Mm-hmm. It's an individualized approach to assisting our patients to return to function, to get back the life they want, and to promote wellness and active living. Because when you get to be my age, it's all about being active, staying active. I want to do the things I was doing as a younger man as much as I can. And part of that is making sure I have good mechanics, good strong posture so I don't get hurt, and so I can continue to get out in the garden. I can continue to play sports. I can continue to do things at the level my body's physically capable of without getting hurt and without having progressive degenerative change. Because your posture, whether it's your spine or whether it's your knee or whether it's your foot, no matter what joint it is, if you have strong posture, that means you have better alignment, which means there's going to be less wear and tear on your joints, less irritation to the muscles, less dysfunction of the nerves. It really is that simple.
But it's also very profound, the way you integrate all of that information.
That's kind of one of my fortes, is being able to do all this stuff, put it together, and make an individualized assessment for somebody and saying this is what you need, or this is what you don't need. And applying it in a drugless format, no medication, no surgery. Does that mean I tell people not to take their medications? No, it means we want to avoid the misuse and the abuse of it. For example, a quick sidebar. There is no research, Jill, that shows that non-steroidal anti-inflammatory medication, Advil, Tylenol, Celebrex, there is no research that shows that's good for back pain. I'm sorry, there's no research that says it's good for it. Okay? The current research shows one of the best avenues of treatment of back pain is chiropractic, physical therapy, acupuncture, right? Active and exercise. That's the top tier management for back pain today. So
and you're using that evidence research in your practice.
Yeah, we are. But what's sad is that so many other facilities go right to drugs and MRIs, and there is no research that shows that that is efficient. It's actually discordant care. And that's just not my opinion. American Academy of Family Practitioners, there's a whole list of them. In Britain, they came out with that. New England Journal of Medicine came out with that. So there's a large consensus that conservative, non-invasive care, drugless care is the way to go first. And according to a Gallup poll, first people go to their medical doctors, second people go to their chiropractic doctor for back pain. Okay? However, according to United Healthcare, if you want to save money, you will save an average of $1,000 if you go to the chiropractic doctor first for back pain. That's based on the statistics of United Healthcare, a major insurance company.
So they did their own research.
They crunched their own data.
Wow.
Their subscribers that went to the chiropractic doctor first for low back pain, on average, saved $1,000.
Wow.
And they see 100,000 back pain episodes a year. So conceivably, if they really wanted to save money, Jill, everybody would know that, and they would save $1 billion a year. But people don't know that because, in my opinion, healthcare is not about saving us money. But let's go back to posture.
Okay, so why don't you tell us about some common postural distortions?
Sorry about that, Jill. I
No,
get
it's an
sidetracked.
important message.
Yeah.
We are in health care, not sick care, and you're promoting health and better health and wellness.
And that's exactly correct. And that's a real dichotomy or challenge
Right.
I have as a physician is, yeah, people come with me with problems, with symptoms, but my big picture is how can we improve your overall health and well-being? And that's defined as not merely the absence of disease or infirmity, but optimum physical, mental, and emotional well-being. That's the medical definition of health. And again, when you get to be my age, I want to stay active.
Right.
And I don't want to start putting a lot of stuff into my body that I don't need, whether it's a vitamin or whether it's a medication. The most expensive supplement is the one you don't need. But the ones you need, you got to take. I mean, thank God for modern medicine. I would not be sitting here today if it wasn't for modern medicine, so don't get me wrong. But healthcare is diet, rest, exercise, healthy mental attitude, taking care of yourself physically, strong posture, chiropractic adjustments to maintain joint function, prevent nerve irritation. That's healthcare. And you're right, it's huge. And people miss that because unfortunately, we're used to saying, oh, if you can't pick up this cup, that means you have cup deficiency, and we have a drug for cup deficiency. It is Buy it, but, and then they tell you all the problems with it. We're just a medication society. But anyway, top 3 postural distortions. Well, you tell me, Jill. What do you think about a weak posture? How it would manifest itself? Let's say from the waist up. How would a weak posture manifest itself in your opinion? You got it.
Technique.
You got it. Being on the computer, being on the phone, driving, okay? Yeah, technique's a huge problem and everybody sees it today. It used to be heavy backpacks. You know, backpacks
Right.
are getting lighter. Now it's
Right.
technique. Real simple to fix, okay? In fact, there's just first of all, you have to make sure the spine and the neck can get into a tall, strong position. That's my job, okay? That's where an accurate diagnosis and a physical assessment exam comes in. Can you physically get there? If you can't get there, well then we have to do something else. Once we get you there, then we have to teach you exercises to hold you there and to lengthen the muscles that have become shortened and stiffened. So technique, you're here, your chest muscles are shortened and stiffened. The muscles in the back of your neck here are shortened and stiffened. And these upper trapezius muscles are shortened and stiffened. So literally you're stuck here. All those muscles have to be relaxed. Conversely, these muscles all have to be strengthened. And if you do it right, it actually shuts down all that tension in your neck. So, and we teach people that every day. Whether they're coming in for lower back pain or ankle injuries or sports injuries, we teach people that every day, those exercises.
So, thank you. I'm thinking about the lower part, the sway back or the punch belly. Or,
Oh yeah, well that's a whole nother distortion. You know,
Right.
that was described by Dr. Vladimir Yanda, a medical neurologist, and he came up with a whole protocol of exercises to fix that. Then we have to get you into what's called Hodges position or posterior pelvic tilt. We got to get your hips underneath you. That problem is the muscles in the front here that are tight right now shorten. The muscles in your lower back shorten, and it creates that low back distortion. Postural distortion is what he called it. Very fixable. Again, treated all the time. But
and
if you're an
pregnant
athlete,
women.
well,
Why?
yeah, that's going to be accentuated
Right,
with it.
okay,
Sure.
okay.
Yeah, but that's temporary.
Right.
You know, if a woman, after she has her baby, gets back to her everyday activities and starts to strengthen up her core and her glute, her butt muscles again, that should recover. That shouldn't be there all the time. But if it doesn't, yeah, then she's got to address it. A lady that's had several several children, gymnasts, or in that extension
right.
position all the time, yeah, that's much more of a concern.
Right. So would you discuss some of your postural rehab protocols?
Oh, sure, sure.
Okay.
I mean, first of all, they got to be simple.
Okay.
They have to be applicable. They have to be doable, but they got to be done correctly. People can go to my YouTube channel, right? And just YouTube, put in my name, Dr. DeFabio, and go to my posture playlist. All the exercises are there. But if you're not doing them right, Jill,
Right.
you're not going to get the benefit. In fact, you could just perpetuate the problem. Okay,
Right.
that's the difference between me saying, okay, Jill, here are your posture exercises, and I want you to do numbers 1, 4, and 6 3 times a day, and you'll be fine. And having someone make sure you're doing them correctly, not only technique-wise, but volume, intensity, and frequency. A lot of information, but that's what you pay me for, and it's okay to ask for information. I have 24,000 subscribers on my YouTube channel. I love sharing information. Don't get me wrong. However, just because you watch a video doesn't mean it gives you enough ability to apply it. It's okay to ask for help to get it applied, whether it's me or somebody else. But yeah, we use stretch bands all the time to do it.
If my structure needs correction to improve my function, you would do that, so I just wouldn't do these exercises thinking, oh, okay, well, I'm just doing this, but there's really a structural or functional problem preventing them from being effective.
We're talking about posture. We're talking about tall, strong posture. We're
Right.
talking about how it benefits your life. The bottom line is the most important thing I do is a proper diagnosis, is an accurate diagnosis. Because if we don't have a good diagnosis, then no matter what we intervene with, isn't going to get us where we want. All right. So yes, if there's a structural problem, if there's something that needs to be addressed specifically, let's jump into that.
Okay.
It's got to
So
get done.
are there any functional postural exercises that...
Oh, but there's only one problem, Jill.
Okay.
I'm going to make you do some. So you want to show everybody a couple exercises?
Yes.
All right.
Thank you.
So we did just happen to bring a CLX band with us. This is a stretch band.
Okay.
It's called CLX Continuous Loop Band. It's made by the TheraBand company. It's wonderful. Latex free. Don't worry about allergies. And it's got these loops in it, continuous loops. Okay? So you can put your hands in it. You can put your feet in it. You can loop it around a doorknob. It's great. You don't have to tie people up anymore like we used to in the day.
Right.
So we're going to use the TheraBand CLX, and different colors mean different strengths. Green is going to be about 8 pounds of resistance, which will be perfect for you, okay, at 200% elongation. The exercise is going to be Brugger's exercise for postural correction of tech neck or upper cross distortion, all right?
Okay.
You can do it sitting, you can do it standing, you can do it lying down. But let's have some fun. You ready for have some fun?
Okay.
All right, so I'm going to ask you to stand up if you don't mind. Can we stand up?
Yes.
Okay, we can stand
We
up?
can
All right.
stand up.
All right, so stand up. So we're going to take your CLX band, put your hands in the loops. Good. First thing you need to do is turn your back towards me. All right, so text neck, do you mind if I pull your hair back a little bit? I think, Jill, if we just take a little bit off the back, maybe put some highlights on the side. No, I'm only kidding. So text neck, your head would be forward, your shoulders would be rounded, right? Not so much, just a little bit like that. Good. So what do we need to do first? You need to bring your chin in a little bit and lift the chest, okay? No, just a little bit, not too much. Good. Now, pinch these wing bones here. Hands go down, open the fingers, tighten here, and then turn out with the arms. All right, so you're going to go like that, okay? Turn out, and then roll the pinkies up. And really pinch in through here. Now, if you do that correctly, these muscles here, which are like a rock, should be like mush. All right, so let's try it again.
Okay.
All right, so chest up,
Just up.
chest up, pinch here, down, turn out, and then a little bit better, out and pinkies up. Okay, and relax. So Jill, you need to work on that a little bit because these muscles here are still a little too tight. They're hypertonic. They're too tight because you've been using them so much that those small muscles don't know what to do. You can't find them. So do me a favor. Do you mind just putting your thumbs right here? Feel those muscles?
Yes.
Right, just feel them?
Yes.
Go ahead. Leave your thumbs there. What happens
they
now?
really loosen, relax.
They turn to mush.
Right.
That's the way they're supposed to feel. Let me have the band, please.
So instead of the tense, they're relaxed.
So that's what I was just saying. You can watch my videos all day long.
Right.
But until I teach you how to engage those muscles and do it right, you're just going to be strengthening those tight muscles more and more.
Reinforcing a bad habit.
A bad movement pattern. It's
Bad
not a habit, it's a
movement
movement pattern. So the burger's positioning be, you can put your thumbs up there. It'd be here, 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 and push on my shoulders. Like mush,
Yeah.
right? And my head's relaxed, okay? All right? And I do that 3 times 15, 3 times a day. Not the best exercise for you. We'd have to break you down. We'd have to go, okay, how simple does that exercise have to become until you can do this and relax these muscles? Oh, man. Yeah.
So my starting point is much more basic than
Just
this.
different.
Different.
Just different.
Okay.
And
that's individual for me.
Exactly.
Okay.
Exactly. But you know what would be really good for you? Put one hand in there. I'll give you 2 loops. Put one hand in here. Okay? You ready? Remember your cheerleader days?
Okay.
You used to be a cheerleader, right?
Yeah.
All right, shake the pom-pom. Shake your pom-pom. There you go, cheerleaders. And then go back, and then do it again. Cheerleaders, come on, like a cheerleader. Keep your head up, good, that back, and then do it again. That's it, and then back. A little knee pump. Come on, get a little knee pump in there. You got a little knee pump. That's it, there you go, and back, and go. All right? So doing that's gonna help strengthen these guys in a movement pattern that's going to help you find them. Then we can go into isolation. So cheerleaders would be a great place for you to start. Okay?
Thank you.
But that's the kind of thing we have to apply individually in the
And that
office.
gives me much more power.
It gives you more
Or
better mechanics.
Better mechanics.
Okay?
And
So
strength.
strong posture, right?
Okay.
You'll have better mechanics.
Okay.
Which means then when you want to do something powerful, you'll have more power. That's how it applies to athletes. Okay? Real simple. If I wanted to pick up something heavy, right, I'm going to pick it up like this. If I'm going to do a squat, I'm going to do it with a good flat back. If I'm going to pick up something light, and I don't think about it, I do this, then my back goes out.
But you're still...
The problem is you have to maintain good mechanics. If I'm here, my back's not going to go out if I pick up something light. If I'm here to pick up the pencil or the stretch band, my back, oh, I was just washing my feet because you bent over and you did this. See it all the time. You have to maintain good mechanics. From good mechanics, then we can go to power and speed. So I don't know if I lost you on that.
No, that's excellent.
But that's the paradigm of rehab for sports performance.
Okay.
But if we do power, strength, and speed now,
Right.
before we teach you how to find those small stabilizer muscles, forget about it.
Okay.
You end up back in the office hurt. Unfortunately,
Right.
or fortunately, depending on what side of the fence you're on, all of my YouTube videos and all this information is to keep people independent and healthy so they can just come in for checkups.
Right.
So they don't have to come in for a series of visits. They can just come in for a checkup, which is great, in my opinion. But if you don't take care of yourself and you crash and burn, then it's going to take a lot of work for me and a lot of time for you to get into the office to get better. So let's do some prevention.
Thank you.
All right.
So
Any other questions? Oh, what else do you want to know? I'm ready.
Are there any other exercises before we...
Oh, you know, it's a good one. This you can get a little door anchor that goes with this. So
Okay.
Put your hands in the last loop. There. And put your hands in the last loop here. This is one of my favorites. For you, standing would be fine. Some people, we do it over a ball. Okay, they're called YTAs, like YMCA.
Okay.
Show me Y, like Y. No, square up towards me. Very important tip for the viewers when you're using a stretch band. The angle of where the band is will make a huge impact on how it affects the muscle.
Okay.
So, for example, let's say you do a bicep curl. Put your arms down. Do a bicep curl. Go ahead. All right? That feels a lot different than if the band was down here.
Oh, yeah.
See what I'm saying?
Yeah.
So the band's got to be in the correct placement.
Right,
So
okay.
show me Y. Great. Now, a T is there, and an A would be down there. So let's say I'm the door, and I have your little door anchor in here, which we didn't bring, and you'll do a Y. Good. Come back to neutral, then T, come back to neutral, and then A. YTAs. Now, let's go back to Y. Hold it. 1, 2, slowly recover, and go to T. Hold it. 1, 2, slowly recover, and then A. Now, can you do all Y's, all T's, and all A's? Sure. Can you do it 1, 2, 3? Sure. But you notice how I said slowly recover?
Yeah.
Because if you go fast, the rubber band did all the work. The
Right.
CLX did all the work.
Okay.
You did nothing. Okay?
That's awesome.
Yeah, great exercise. That would be really good for you.
Okay.
Because you'll be able to hold that and start to find those muscles in your back. Yeah. Here, you can keep the CLX.
Thank you.
On me.
So really, the takeaway is that the cause and effect of a weak posture could be neck pain, back pain, headaches,
Yeah.
sciatica, plantar fasciitis, knees.
Exactly. The
So
takeaway.
that's your takeaway for our.
That's your takeaway.
Okay.
Thank you very much for, I have a tendency to talk a lot and don't get to the point. That is the point.
Okay.
What I've realized in my practice is that's what I've been slowly doing for the past 34 years, is restoring strong posture for those sprained ankles, for those injured knees, for the arthritic hips, for the people with headaches and back pain and shoulder pain. And now that we have the research to show that, Vladimir Yanda's research, Pavel Kovar's research, Paul Hodges, Stuart McGill, all these great MDs, PhDs have come up with the evidence that shows strengthening posture will improve quality of life and health. And yes, it boils down to headaches, back pain, neck pain, shoulder pain, knee pain, plantar fasciitis, shoulder tendonitis, impingement syndrome. Yeah, that's the symptom that people come in with. And unless there was acute trauma, the problem was a postural distortion over time.
Thank you, Dr. DeFabio, for your amazing insights and for your evidence-based research.
You're welcome, Jill. Thank you for having me. I really appreciate it. And we need to get the word out about health management. So your commitment to that is empowering to me. So
Thank
so
you.
thank
Stronger posture, better health with Dr. Donald DeFabio.
you. Ooh, I like that. I'm going to steal that.
And they can contact you at?
In my office in Berkeley Heights, 908-771-0220, or via email, DeFabioChiropractic@gmail. Oh, yeah.
Favorite color?
Oh, yeah. So the tip I give my patients is, Jill, what's your favorite color?
Purple.
Whenever you see purple, reset your posture. Chest up, shoulders down, relax the head, ear over the shoulder. Okay? And if you're standing, you want to have your foot, what yoga calls it, rooted, weight on the big toe, the pinky toe, the heel, knees slightly bent, pelvis in neutral. But those are all
Thank
things
you.
people have to learn and then
Thank you,
apply.
Dr. DeFabio.
You're welcome.
I'm Jill Lally. We appreciate you joining and watching us.